just let Bob get settled. Matt, let me read about the 45 cases. Ready? Okay. Good afternoon and welcome to the Westport Board of Health meeting for January 21st, 2026, which I'm calling to order. Under Mass General Law, Chapter 30A, Section 20F, this meeting is being recorded. And please join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, we have the director's written report. Any questions on that? Otherwise, I'll let Matt go to take them.
Okay. So we have, so Massachusetts is reporting very high flu activity with cases climbing. The Massachusetts Department of Public Health is reporting very high and rising levels of influenza activity statewide as the Commonwealth moves through the peak flu season. Thousands of residents have become ill, forcing them to miss work, school, and other activities. Many are experiencing serious complications, leading to increased visits to urgent care centers and emergency departments, and high levels of hospitalization. Right now, Westport has 45 reported influenza cases this season, and what I mean by reported is if they don't go to the doctor and it doesn't get reported through the Maven system, we don't know about them. So the cases in Westport, I'm sure, are much higher than 45, but these are the only ones that are being reported at the moment. Governor Healy condemns the CDC rollback of childhood vaccine recommendations. On January 6th, Governor Healy condemned the Centers for Disease Control and Prevention's decision to significantly reduce the number of recommended routine childhood vaccines. Governor Healy and the Massachusetts Department of Public Health are making clear that despite these misguided federal decisions, Massachusetts will continue to recommend and provide easy access to all vaccines. All the vaccines that for decades have enabled families to protect their children from preventable diseases. DPH has put together a childhood immunization discussion guide that are available from the American Academy of Pediatrics. And if you go to www.aap.org and just click on discussion guides, it will take you through that. On January 12, 2026, the Environmental Affairs Secretary Rebecca Tepper declared that central and northeast regions have worsened to level 2 significant drought. Conditions also declined in nearly all other regions, moving the southeast region to a level 1 mild drought, which that's our region. So, for regions in level 1 mild drought, Residents and businesses should minimize overall water use. For larger buildings and businesses, conduct water audits to identify areas of leaks and potential water conservation opportunities. Communities and municipalities should establish a year-round water conservation program that includes public education and communication, taking advantage of the state's Library of Outreach materials. Provide timely drought and water conservation information to residents and businesses. Check emergency interconnections for water supplies and develop a local drought management plan. State agencies will continue to closely monitor and assess conditions across the state, coordinate any needed dissemination of information to the public, and help federal, state, and local agencies prepare additional responses that may be needed in the future.
And do you want to talk about the cold?
Yeah, so it was very cold today. It's going to be cold tonight. I think it's going to warm up through the day tomorrow, or maybe even tomorrow night. But after that, on Friday, Saturday, and Sunday, and even Monday, it's going to be pretty cold with temperatures down possibly the single digits. So residents or anybody for that matter should just be aware of that, prepare, and as we get new information, we'll post it on our webpage.
You have to be out driving, you know, in really cold conditions. Make sure you have emergency preparedness kit in your car, you know, an emergency blanket, and food and, you know, snacks and water in case you get stuck somewhere.
And also pets, to have pets indoor, to bring pets in that are normally outside because it's getting too cold for them.
Okay, let's move on then to director approved plans.
Okay, we have a one-bedroom, it says repair on the list, but new construction for 226 Old Harbor Road for Robert Delgadio. This is for a an ADU. Yes, this is for an ADU add-on. Just want to make sure of that.
Yeah, it's a separate.
Yeah, separate ADU add-on to the property, one bedroom, and it's been through Concom. Lot size 175,517 square feet. We have a 3-bedroom repair.
Can we backtrack? Is this the one you said Lynn wanted to design it for a 2-bedroom?
Yeah, so technically, because there's already a home on the property with a septic system, the system doesn't have to be designed for the minimum of 3 or 2 bedrooms like it says in Title V. The ADU regulation allows it to be designed for 1 bedroom, but they wanted it to design it for 2. So, I mean, the lot square footage would allow for it. It just, you know, if they wanted to put a 2nd bedroom in it someday, they could. They're already doing D9, they're doing a singular system there.
But we should just record it as a 2-bedroom system then?
We should record, it's a 1-bedroom with a 2-bedroom system.
Okay. Okay.
Right. And technically then, if they're gonna go that route, we should do a deed restriction.
Should we do it
Because
now?
in Len's application, he's citing the Title V requirement. And the requirement is if you're gonna design it for 2 bedrooms, then you have to have a deed restriction.
But if you design it for 1 bedroom for an ADU, you don't have to have a deed restriction. That doesn't, like,
Yeah,
it's the way,
Yeah.
disconnect between the new ADU rules and Title V. So what do you recommend? Should we?
because he's citing Title V and not the ADU regulation, he's citing Title V, that it's, you know, they can design it for a minimum of 2 bedroom. I think if they're gonna follow those rules on the minimum design criteria, then I think we should deed restrict it.
Okay. All right, we'll note that.
I don't know, he's kinda going on off of both, so, that would be my recommendation. I mean, at the end of the day, they got enough land, if they wanna come in and add more or something, it'd be easy enough for them to update that deed restriction or remove it.
Okay, okay.
So I want to be clear, is it for a 1-bedroom deed restriction or 2?
two-bedroom deed restriction on the ADU, not on the
Okay.
house.
Okay.
Okay.
Okay, moving on, we have a 3-bedroom repair on a 3.6 acre lot on 984 Drift Road for Jill Tate. This has been through Concom. We have a 3-bedroom repair on a 149,411 square foot lot, 96 Forge Road for Nancy Reposo, care of Mike Donovan. This has been through Concom and it's replacing a cesspool. We have a 3-bedroom new construction on 2 Wayland Way for a Katrina Pimentel and a Chris Barroso. This is pending Concom. And we have a 4-bedroom new construction at 673 River Road for 673 River Road, Westport LLC. And this one's pending Concom.
I'll just note that the property at 984 Drift Road, because I was entering in the database, was an unknown, a house from 1920. So we don't know that it was a cesspool. They say it's not, but it's one more property that we don't have to worry about tracking down. So that's great.
All right, so I move to endorse the director approved plans at 226 Old Harbor Road, a 2-bedroom deed restriction
On the ADU.
on the ADU, 984 Drift Road, 96 Forge Road, 2 Whalen Way, pending Concom review, and 674 River Road, pending Concom review.
Second.
Motion made and seconded to approve, endorse the director approved plans. As noted, all in favor?
Aye.
Aye, that's unanimous, thank you. Okay, moving on to minutes from the last meeting.
I have no changes or edits.
I'm fine.
Okay, so I move that we approve the minutes for January 5th, 2026.
Second.
All in favor?
Aye.
That's unanimous, thank you. Okay, moving on to other business. Want to start first with Board of Health priorities statement. Well, let me ask, are there any comments or concerns with the statement from board members?
There was nothing about, now whether it's separate or not, animal control in there. I mean, we have,
This is, yes,
it's for the Board of
Health
Health, not, but not the animal control.
right, yeah. Okay, then I'm gonna read this statement for the record.
Oh, I have a comment.
Sure.
Yeah, a couple. So one, I thought in the core functions, listed, I mean, one was the annual, I just call them the farm inspections. We're still gonna do that? You know.
Barn books?
Farm,
The barn inspections.
barn inspections.
Barn books.
The barn books, yeah.
We've done them.
Okay.
Yeah, that it remains a priority, core priority.
Oh,
Yeah.
yeah.
It remains a core priority.
Yeah,
I
yeah.
just thought, you know,
Sure, we can add that
that it'd be worth it, you know, just to add that, just so.
for the statement,
Yeah, for the statement. And then, I mean, this goes to the PAWS program expansion, and on the, and so the no new programs, but then this was more of a, not necessary, but just to say where we're coming from, which is to review and potentially suspend low impact. And I thought that maybe there were opportunities, you know, to, other than full suspension, maybe some sort of revision or,
suspension or revision.
yeah.
Mhm.
And then this is more the if we're doing this for the whole year, just because the two things that I've been working on with Matt related to stormwater and private wells, and I don't know if we're saying we're just going to do nothing on those at all, you know, to move anything forward on that, because some of them we've made a fair amount of progress on. And so, you know, it's just, and then there's what we were talking about, you know, just about dealing, kind of preparing for the cesspool closure date,
Right.
which I just started to work on. And again, I would just hate to just throw them overboard.
Well, it's not, so I think I'm just trying to still get my bearings of not having being down a full health agent. Once I'm able to settle into some sort of schedule, I think we can probably, we're really close, I think, to just being done with the stormwater.
Yeah.
I think that could be done quickly.
Yeah.
But we're kind of still way off on the well rate. We still need to, there's still a lot to that we have to go through. So that's gonna take a little longer, but
Yeah.
I still think we could probably get to it at some point and start working on it again in the next couple of months.
Right.
But even when we do that, it's still gonna take a while to come together.
Yeah.
But I think the stormwater, I think we're there. Maybe a couple minor things, but I think we could probably get that done by middle of February, end of February, and retire the one that we have and put the new one in place.
Well, so I don't want to, I guess if there was, even though it's nice to have it like this, you know, if we were going to even say, you know, revisit timelines for completion of, or so that, as you were saying, there could be a point in the process where you would saying, okay, now I have some time to devote to this based on everything that's going on. Because you can read this as that this is like the only thing that we're going to do, whereas I was just trying to build in some flexibility of revisiting topics that, oh, there's a window of opportunity here to move this forward, or to, you know, not complete it, but to, you know, make some advance on it. And I don't have language to that effect, or maybe we are just agreeing to that among ourselves, that that's the way we're going to implement that. That's all. And that you felt comfortable with, you know, finding time for things if there was time there, and continuing to identify these three things as priorities.
Well, I wanted to just touch on the regulation. Where is that one? So the two regulations that, you know, as examples that we're given, we're not going to. I guess it was never our intention to just shelf them 100%, but we're going to eliminate certain aspects of those regulations, the most burdensome part on the staff.
Right.
Still have the regulation itself, but
Right.
eliminate what's, you know, the most, just at least suspend temporarily part of the regulation.
Yeah.
That was the intention.
Right, no, I got that. Well, it was maybe it was because the two examples that you used, I understood those as ones that were more, again, kind of the administrative burden, the cost benefit of doing that versus the more global, you know, changing how we manage stormwater, or these more major reg revisions, which was, you know, more about the content of them rather than the administration of them.
Well, thanks, Phil, and I understand and certainly am supportive of being able to move forward on what we can as time allows.
Yeah.
I think that the part of the point of this was that the staff, the Board Health Department office has been chronically understaffed. We need more clerical support. We've been asking for years.
Right.
And maybe, you know, we'll get something at town meeting. It's not in the budget, but when the workload continues to increase and the staffing doesn't, it reaches a critical point, and we're getting at that critical point.
Yeah,
And the
yeah.
same holds true for Matt. We cannot afford to have him burn out, get sick, whatever, when he is carrying the load of 2 full-time staff, because we don't have an agent. We've had the posting approved, but it still hasn't been posted. You know, 2 weeks later, it just adds to the delay. And so I want the community to be cognizant of the constraints on the health department. And so what do we have to focus on? And just
Right.
be really clear about that. It is not to say, and also for us to be cognizant of the burden on Matt's time, and that we have to be sensitive to that sometimes he's not enough time to do something.
Yeah.
Right then or whatever. And so it's really more of a broad brush statement. Our next agenda item is to schedule a working meeting where we can
Yeah,
sort of
and well, maybe it was
dive-
just because I wasn't sure necessarily who the audience was, you know, for this, in that sense. But it was, I think our practice was, like, look out for 6 months and then kind of back and revisit where we were. And so, we're just having this conversation now, but as I read this is like our 2026 priorities, which was kind of ways. So nothing that's if it's not on this page, we just should forget about it for the rest of the year. And that's really all I'm saying.
Right.
Okay.
No.
I mean, if Matt said to me, I can't do anything for the next 5 months, I would say, okay,
Yeah.
all right, we'll just deal with it.
Right.
That's fine. I'm not trying to, you know.
This
I
wasn't
agree
intended-
with everything that you're saying.
Yeah. This
And I
wasn't-
just didn't want to close the door on things if opportunities arose.
This wasn't intended to be like specifically a priority statement for our board members and what we're working on and what we want to
Yeah, yeah,
prioritize.
yeah.
It is really the functional ability of the health department to serve the public with the mismatch in
Yeah,
available
yeah.
resources.
Okay, that's great.
So that's really where it's coming from.
Yeah, yeah.
So let me, before our 2:30 meeting, let me read the statement, so it's in the
Oh,
record
okay, sorry, I
for the
didn't
public.
mean to consume that much time.
And then we'll come back to the other business items
Yeah, yeah,
after
yeah,
our appointment. So, in 2026, the Board of Health will prioritize legally mandated and high-risk public health functions, including Title V septic oversight, while supporting staff retention, risk-based service delivery, and shared services collaboration during ongoing staffing shortages. As I mentioned in our discussion, those include insufficient clerical staff, and we're down a full-time health agent. So for the purpose is to protect public health, maintain legal compliance, and support staff during continued staffing shortages by prioritizing mandated and high-risk functions and adjusting service delivery where permitted. Core functions that have to be protected include, the department will prioritize activities required under Massachusetts law and regulation, including communicable disease control and reporting, that's from the Department of Public Health, food establishment inspections, Title V septic system oversight. We have to limit perks to emergency perks at the moment, address housing complaints, respond to imminent public health hazards and nuisances, emergency preparedness and response coordination, and of course Barn Books is one of those mandated services that will also be prioritized. These functions carry the greatest public health risk and municipal liability if delayed. With regard to septic systems and perk testing under Title V, septic oversight is a statutory responsibility and will continue with adjustments to reflect staffing limits. Maintained priorities include review and approval of Title V system plans, oversight of failed systems, repairs and upgrades, review and Review and observation of perk tests when required, but on a limited basis. Again, prioritizing failed or emergency perks. Operational adjustments, again, risk-based scheduling, so failed systems in sensitive areas will be prioritized. Strict enforcement of complete application requirements, extended timelines were allowed by regulation, and deferral of discretionary or advisory site visits. Septic and perk testing are not eliminated, but managed to protect public health and staff capacity. Risk-based service delivery, the department will use risk-based prioritization rather than first come, first serve. Examples include high-risk food establishments will be prioritized. Housing and nuisance complaints will be triaged by severity. Septic failures and emergencies will be prioritized. Board support is essential when lower risk services are delayed. That means we, as a board, have to support, are supporting the board, the health department in the prioritization method of service delivery, because we can't do everything that we would like to do with the staffing limits that we have. Workforce stabilization and retention. Staffing shortages are a governance issue, not just an operational issue. So part of our focus on 2026 is retention of existing staff, restoring staffing levels to what we had before, and increasing where we are understaffed, which is especially in the clerical realm. Cross-training for operational resilience and realistic service levels to reduce burnout. Key indicators there will be staff retention and hopefully some staffing increase at town meeting. Shared services and contracted support. Again, we are the lead in a grant, and we're going to use that where possible to share inspectors or agents from the collaborative and contract services for overflow or specialized needs where we have the resources to do so. Part of this will also be pausing any program expansion. We can't adopt any new programs unless legally mandated, and we'll review, potentially suspend or revise low-impact staffing-intensive services, such as dumpster permitting requirement and portable toilet permitting requirements. And part of this is we need to maintain transparent communication. We're supporting clear and public messaging regarding services that are delayed or limited, so people understand there's only so much we can do, and that these are related to staffing constraints, and that we're focused on continued protection of core public health functions. We don't have time for further discussion on that. We can come back to that. In the meantime, I'm going to call the 2:30 appointment. Len Potter, representing 198 Cabins Neck Road, the Viveris Irrevocable Trust. This is a 3-bedroom repair with a quick 4 and single air on a 5,116 square foot lot. Very tiny.
Good afternoon.
Good afternoon, Mr. Potter.
Len Potter, Westport Environmental Design, representing the Viveris Trust, and also Thomas Loftus. When I submitted the applications, I submitted them together simultaneously, and what happened was the board hadn't decided when they were going to have their next meeting after January 5th at the time. So the secretary mistakenly just scheduled 198 and not 200 the same day. I sent my letters out to the abutters because all the abutters concerned with 198 are involved with 200. So I think the first order of business should be that open the hearing for both 198 and 200 and just continue. They're both probably going to get continued anyway, but continue 200 to the next meeting, which I think is February 2nd. So I don't have to re-advertise or resend letters out.
Sure. We can accommodate that, I'm sure. February 2nd, yes, you are correct. Okay.
Is that okay?
Yep.
All right, so we can, you want to give a time on?
I'm gonna have to ask.
For the
Or we can, just a 200 Cadmus Neck Road, we're given a time on?
There's probably gonna be a continuance on this, I believe, but yes, I wanna open up 200 on the second also.
Okay, so that's gonna be, it's already in the book for 440,
440.
yep,
Okay.
on February 2nd.
That way everyone knows what's going on.
Okay.
And those cards, the cards I submitted, I sent the same letters out to all the parties involved, so those cards will suffice for the next meeting.
Okay.
It's just one of those things that happen. It's okay.
Okay.
I represent the Megan Viveris Trust, and Antone Viveris is here, and these are both very difficult repairs. I was here a year or so ago and asked the board if I could relocate a well. 2 well points in the back of these 2 properties. We put a well point in at 200, and there are 2 large oak trees in the rear of those properties, and all I was coming up with brown water, which is tannins from the oak tree. So that was no success. So therefore I was left with what I had to work with. And what I have to work with on 198 is I'm installing a 2-trench system along the side of the house and the front of the house. And I end up being 35 feet away from Mr. Viveris's well and 36 feet away from the Loftus well at 200. I am 51 feet from the well at 192 Cadmus Neck, Shirley Robbins, and Dorothy Sang, I am 97 feet away from hers. So all these wells are less than 100 feet. In order to put the system between, I've got no room to be less than 10 feet from the line and 10 feet from the house. I can't do it. So I'm asking for a variance to reduce the distance between the house and the side trench to 2.5 feet, and from the front of the house toward Cadmus Neck Road by 3 feet, and 6 feet from the town road. The out front trench will also be 4.8 feet from the property line. The distance of the septic tank to the well is only 27 feet. That's another variance that I'm looking for. The only fortunate thing is the sunroom shown on the plan is a slab, so it's not a basement. And the house itself is a basement, and there's a crawl space to the rear. So my intent is to dig right up against the foundation of the house and install a PVC barrier. And the system is completely below grade, the water table's good, and that will allow me to get something on the property. I've asked for a reduction in the flow by 50%, reduce it by 50%, because I am using a denitrification system now. And that's exactly what I'm asking for. So the waivers I need, proposed system is less than 10 feet from the property line at the road. Proposed distance is 6. Proposed system is less than 10 feet from the slab and crawl space. Proposed distance is 2.5 to 3 feet. Distances from proposed system to the well at 192 is 51, and 204 is 97. Those are the waivers. The variances, existing well at 198 Cadmus Neck is 27 feet from the proposed septic tank and 35 feet from the proposed system. The distance from the existing well at 200 Cadmus Neck to the proposed system at 198 is 36 feet. A reduction of the leaching area to 50% of the minimum required due to use of a D-Nite component installed in system, and there is no room on the lot without this variance. The distance of the proposed leach field is less than 10 feet from the property line. Proposed distance is 2.5 feet. The line has been surveyed. It was surveyed for Mr. Viveris a few years ago, and I forgot that I needed a land surveyor to stamp the plan. I've got a land surveyor going out there now, and he is doing his survey work. So once he completes his work, he'll give me a plan with the exact distance from the side of the home to the property line. There is a fence there, and Mr. Rivera says the fence is actually 2 inches from his property line, so I know I'm close, but I can't give you an exact measurement. But I just want to open up the hearing. Until I get that, I can't do much about it to give you exact measurements, but this is the problem that I have. So I'm asking for commentary, suggestions, or anything else that I can get.
Can you walk us through the well test results?
I don't have the well test with me. I think they're okay.
Except for 200 nitrates are high.
What is it? I mean,
200, Cadman's Neck, its nitrates are 8.6.
8.6.
And 192 is actually 10.
Is it?
Yeah. Oh, I'm sorry. I read the wrong column. 126.
Yeah,
Sorry,
it's
sorry.
not.
I was
I
worried about
missed
that
that, I'm looking at these things really closely.
Yeah. I was looking at the wrong column, so, okay. Then the only one of concern is 200, which will be, you're doing a new system there too. So-
Right.
Okay.
They're both going to be denitrification units.
Okay. Other question, let me, sorry. Go
No,
ahead.
Glenn went through it pretty thoroughly. I don't have anything to add.
Okay.
What was that?
I know, she was gonna ask me if I had anything to add. I said you went through it pretty thoroughly. I don't
Yeah,
really have anything to add,
no.
to this. It's a very tight squeeze.
Okay, questions from the board?
I don't have questions. It seems from the variance that what we would be saying is in terms of the justification for it, being that there's no other, feasible alternative, and that it's generally going to be an upgrade, and that using the denitrification system is a way that we are getting kind of equivalent environmental protection. So,
Maximum we can achieve.
yeah,
Mhm.
so I think it covers the
Just-
variance criteria.
Okay.
We have to wait for the surveyor's report to make sure
Yes.
that all of,
Update the plan, right? Okay, so, what I'm hearing is there are no additional concerns to be addressed. We get the surveyor's plan, so we can continue this to,
So you wanna continue
450?
this one as well? Yeah, 450? No, I'm sorry. Yeah, 450.
200 is already continued to 440. Do we have something at 430?
Yes.
Okay, so we'll continue this one to 450.
450, that's fine.
Is that right?
Yep.
I'm just, no, I mean.
Yes,
Matt, I'm
that's
just
correct,
checking to
yes.
make sure There's
Okay.
nothing else. So this is, will be continued, but I know that there's an abutter here, just asking, do you have any questions, or the property owner want any questions or comments?
I just wonder why we don't do tight tanks.
Either one of you, Jen?
It's certainly, if you found this not to be feasible, it's allowed for this specific situation. It's not new construction, and certainly I could view this as not feasible with all the different variants and local upgrade waivers. I could see a tight tank being, allowed if that's what they wanted to do.
Potter?
Well, a tight tank is acceptable in an extreme situation, but I think it's always preferred that if you can get a subsurface system in, then that's what you want to do.
Mhm.
So,
Okay.
Go ahead.
No, I was just trying to, refresh my recollection, knowing that, these seasonal homes,
no.
yeah, so my recollection is that if you're not in a seasonal criteria, there's very limited exceptions that allow for a tight tank.
There is, if it's determined that it's not feasible.
Oh.
And I
okay.
could, this, in my opinion, this
So-
could go either way,
Oh,
but
okay.
because there's the sheer amount of variances and local upgrade approvals,
Mhm.
that's, you know, my thinking.
Yeah.
Yeah.
This would have been an ideal place for a shared system.
There's not much room even with a shed.
Well, not just, but for the
Yeah.
all of cabins.
Oh,
and
yeah,
everything.
I agree with that.
It's, you know, it just has to be something that the community wants.
Can I ask a question? I'm not sure what property you're here,
192,
excuse me?
192, I'm 51 feet away.
Fortunately, the nitrate levels indicate that there has not been contamination, so, you know, I think we could, we'd have to make a determination that it wasn't feasible, and there is some sort of manifest injustice kind of argument to be made for this property to be able to do the 50% reduction in leach field. I think it's a kind of a judgment call on the part of the engineer.
I'm not opposed to him doing it.
Yeah.
Because it's tough down there in cabins, it's very tough.
Understood.
You know, I don't want him to have a problem, I don't want to have a problem, I don't want anyone to have a problem.
Right. Tight tanks come with their own risk profile, so it's sort of, it's not necessarily an ideal solution. I mean, that's why they're very limited in general. Okay, any other comments? If not, I'll take a motion to continue to 4:50 PM on February
Second.
20th, February 2nd.
On 198 Catherine's Neck Road.
Yep.
So moved.
Second.
Motion made and seconded to continue to February 2nd at 4:50. All in favor?
Aye.
That's unanimous. Thank you, Mr. Potter.
Thanks, Glenn.
Thank you.
Thanks.
We opened the 200 Cadman's Neck Road.
There's copies of the abutters letters.
Okay. Is this for both, not
That's for
198?
both. That's
Okay.
for both.
Okay.
I do
So,
both at the same time. Thank you.
okay, I'm just going to officially open the 200 Cadman's Neck Road project for Thomas Loftus. This is a 3-bedroom pair with quick 4 and singular on a 5,570 square foot lot, which will be continued to February 2nd at 4:40 PM.
So moved.
Second.
All in favor?
Aye.
That's unanimous. Okay. So those are continued. Now we can return back to our other business. Scheduling a working meeting, and this is sort of something we had talked about last time. We wanted to talk about the cesspool upgrade situation. We can talk about sort of our board priorities, you know, how do we want to sort of line things up based upon staff availability and resources. So priorities, other things that we want to delve into at that working meeting. Matt?
I think we should talk about the cesspool closeout strategy, and, you know, I know it's 2 years away, but 2 years moves quickly, and
Yeah,
we need to be well prepared and ready for what that's going to look like. And I don't, even if we replace the health agent, if everybody waits, you know, we're getting a good amount of turnover, but there's still a whole lot more. And if everybody waits and decides they're going to all do it, you know, in, you know, January of 2028, I don't know how we're going to handle that. So we should probably strategize a little bit about that.
Yeah, I will work on getting updated data from the database about where, you know, so what progress we've made.
And those are just for the knowns. We still got to
Yeah,
figure out the
I know.
unknowns.
Yep. Well, we have addressed a reasonable amount of the repairs that come in turn out to be unknowns. They don't, you know, the engineer doesn't know it's unknown on our list necessarily. So we've had some reduction in unknowns. Like the example today at Drift Road, I believe, was an unknown. So now it's a known, because we have a repair plan coming in, so I converted that to a pending, in the database, so anyways, I'll have some more information on that. And we do have that first tranche of about 50 unknowns. We were gonna try working on a strategy for doing a mailing there. So, yes, so cesspool closeout strategy will be the major topic of discussion. But we can talk about other priorities like, when do we think we can tee up stormwater, or other activities. I also will want to talk about household hazardous waste planning. We were scheduled to have a meeting with the selected contractor, which is Trident, tomorrow, but he has COVID, so that's been postponed. But for us, we have been given guidance that for this year, we have to live with the amount of funding that's available, which is below the estimate. And we're not in a good place necessarily to charge, or charging a fee doesn't help us because the revenue wouldn't come to us to pay the bill. So we have to figure out a way to manage that so that we stay within budget. Any other items for that meeting, and then we can schedule it. So next week is a non-meeting week, so that's a possibility. I would shoot for later in the week, so we've had our meeting with household hazardous waste guy.
So I was thinking more that I wanted to try to meet with Phil and talk about the stormwater, and because I think we're pretty close to getting that done.
Okay.
And if we can do that and then have the working meeting and bring it to the working meeting for the board to review and kind of like a final approval thing, and we can move that into if we're going to have a public hearing and finalize that.
That would ultimately be a workload reduction strategy, so that would fit in with the priorities.
Okay, so I don't know if that's, so I guess my question is, do you want to have the meeting next week, or do you want to have an opportunity to sit and go through it and then have the meeting like 2 weeks from then?
Yeah, I was just looking at the calendar, and strictly that. If you think you're close enough to get a draft version for a working meeting, then I'm happy to.
Well, I think that just maybe for both of those, at least I'd like a fair amount of lead time. Like if you circulated the data, and then I have other stuff I could try to put together for the cesspool part of it, just kind of get the statutories, like any of those kinds of stuff. Give people like a chance to really look over the material before we have the meeting.
Yeah, okay.
That's what
Yeah,
and so it's like
next week is not on the
yeah.
on
So
the horizon.
I know it's,
The week
and
after,
I don't know that so I don't mind doing it
waiting.
like the 2 weeks
So
from
the week of
now.
February 9th or the week of February 23rd? I don't want to wait too long for that household hazardous waste piece of it.
Okay, yeah, well, that's okay. Well, maybe that's okay, yeah.
Yeah,
I know that I have a CRC meeting coming up, and I think it's the 3rd week in February.
Okay.
So that would be a lot of meetings. That'd be like 4 meetings during that week.
Okay, so, I'm looking at the 2nd week of February, the week of February 9th. And that if that's too early for the stormwater, we can schedule another working meeting.
Yeah.
Can you just refresh my memory? When's the household hazardous waste day again?
March 28th.
March 28th?
So we need to get agreement on the plan for that relatively soon.
Yeah.
So I'm a little anxious on that. Because we do have the funding and we have the vendor lined up, so I don't want to cancel it.
No, so you mean getting it advertised?
Yeah, just figuring out what's our strategy. Are we going to have people sign up? But all that kind of stuff. How are we going to manage it so that we don't exceed our budget?
So then, what was the suggestion, February 21st? I mean,
No, the suggestion is the week of February 9th.
February 9th.
And what, you know, if that's too early for stormwater, we can schedule another one later, but at least I want to talk about some
So,
of the cesspool stuff and
Yeah.
household hazardous waste.
Like,
And
when,
so, right,
the 11th, maybe? That's a Wednesday?
Sure.
I don't know if that works
Is
for
that
everybody,
all right,
but
folks?
um,
Um,
okay, so let
I'm
me go to,
flexible.
yeah, I mean, we.
I have a doctor's appointment at 1:45, so anything in the morning would
How
work.
about 10 a.m.?
On the 11th,
Yep.
okay.
Okay.
10, what did you say, 10?
10 a.m.
Oh, 10 a.m., okay.
Okay, I'll make the motion to schedule a Board of Health working meeting for 10 a.m. Wednesday, February 11th. Discussion items include the Household Hazardous Waste Day planning, some cesspool closeout discussion, at least preliminarily, and if we get to it, stormwater, but we'll just, you know, sort of priorities discussion. We can leave it generic at this point.
I second.
Motion made and seconded, all in favor?
Aye.
That's unanimous, okay.
And then our regular meeting is on the 9th?
No, our regular meeting is on the 2nd.
Oh, it's on the 2nd, okay. Oh,
And
yeah.
then
Oh,
we
there.
have already rescheduled the President's
To the
Day
18th.
meeting to the 18th.
Okay. Hmm,
At 2 p.m.
You have it at
on
2.
Wednesday, the 18th. Do you have that? So,
Wednesday, the,
18th of
18th.
February is our next, is the replacement for the President's Day
oh, okay.
meeting. We voted on that at the last.
Okay, and what time is that?
2 p.m.?
Okay, 2 p.m., okay.
Okay, so, okay, board member updates.
Bob and I had a very frustrating meeting last night. We're really having a hard time moving forward. We did meet and discuss some options. Finding out that the police department lost their grant to do their follow-up after overdose in homes. The school department is also looking at creating a position, but we can't move forward until the RFP is, and the town manager is giving some direction on how do we proceed. We were waiting for his input. He has not yet reviewed and got back to me on the RFP that I sent to him. So we're trudging along. We're hoping, you know, to get this moving so we can start allocating some funds, but that's it. And I haven't begun to think about how I want to do Mental Health Awareness Month in May. So I take any suggestions for topics to move forward with that, so I can start scheduling some people and some presentations. So.
would you mind if I ask Olive to work with you on that to help
Sure.
do what you just
I
asked?
love working with Olive.
So I'll ask
I
her.
think I want to do something again on the opioid stuff, so, and I know that's her area of expertise, but I think that she may come up with some other ideas and have some other contacts so that we can put something together in town. It would be great to be able to put something together like she did at UMass and at the high school.
Mm-hmm.
No, I'll pass on updates.
Okay. I, of course, got the column out about flu and vaccines. And I'm trying to remember what we were scheduling for the next columns. You were gonna write
I
something.
was going to, and don't commit me to a particular week in February, but I was going to do a kind of presentation summary of the hazardous mitigation response plan that the select board approved a few weeks ago now.
Okay.
And it's still out for federal and state review, but I still think because the town has kind of formally adopted it, you know, that we can talk about it.
Sure.
And I don't expect those other agencies, you know, to turn anything upside down. So that was what I was going to talk to, at least one of the things, just to talk to Matt about. And because there's kind of an overlap. So the Climate Resilience Committee, you know, has been working on its plan, and, you know, for some of those topics, you know, storms and floods, and there's an overlap, and so they're going through the process of now trying to rank the different impacts based on their magnitude, the disproportionality of the impact, and what we call the adaptation gap, meaning where we'd like to be and where we are right now. And so I was going to talk a little bit to Matt about that. And Don, I'm going to actually try, once I get a draft together soon, you know, connect with you and maybe Michael, and just to, so it's just not like Phil's idea, but it's like the three of us have, you know, just some sense of it. So stay tuned for
Well,
that.
we have been we worked together on
Yeah.
the health
Yeah.
part of
It's
climate change.
yeah. Without belaboring it all, you know, it's complicated because the scale of the data is statewide and even regional, which includes all the Cape, the islands, South Coast. But then you're trying to refine it down to the town of Westport,
Yeah.
and then even within Westport, you know, how does this affect the north side of town? How does this affect the south side of town? Is it just, you know, anyway? So it's, you know, it's kind of complicated, but that's what we'll be working on.
Life is kind of complicated these days.
Yeah, it's, you know, but
Okay.
that's that.
Okay.
I'm going to give this to you,
Oh,
because
okay.
it says sign, make sign, and then pass it down if you can.
Can't remember.
Yeah, well, I talked about, I do for
Oh,
Mental
in
Health
April.
Awareness Month, but that would be in April. I would do it at the end of April.
So I'll put myself in for March is both, well, household hazardous waste, but also cesspool kind of close out. Maybe we'll have something by then. Okay. And then for my update, I am scheduled to meet with a representative from the Watershed Alliance, because they are sort of evaluating where to go next around sewer, and talk about our data and what we can share with them on that. And that might help us think about the cesspool closeout
Yeah,
strategy.
I mean, I think that, yeah. Not that we're starting with a clean slate, but I think we should come to that discussion just with an open mind, knowing, just like thinking about, okay, we're like treading water to keep our head above water. We have this, you know, big lift to dig into all the cesspool stuff and like what's realistic,
Right, yes.
you know, and what we should focus on.
But I think it's also important to take some lessons learned from the failure of the past effort for the Watershed Alliance.
Oh, yeah,
in
yeah,
terms
no,
of
I
how they move
you know,
forward. So
yeah.
It'll
no,
be an
I
interesting
agree.
discussion. I'll report back at our next meeting.
Yeah, no, it's, you know, just, yeah. I mean, even from a targeting point of view, if you were looking at what we did, you know, where's likely sewer to be, how does that overlap with cesspools? How do we want to factor that in even?
Mhm.
As we did when we extended the date the last time.
Yep. Okay, all right, I think that's all that I've got. Do we have any topics for the next meeting? Nothing unanticipated, I don't think.
All right, so being there no further business, I move that we adjourn this meeting at 3:02 p.m.
Second,
All in favor?
aye.
That's unanimous. Thank you very much, everyone. Thanks, Bob. Thanks, Valerie.